in statistics that paint a somewhat dim picture when it comes to young people being infected with HIV/AIDS. And joining me in studio to discuss that is Lillian Ndukwe from AIDS Healthcare Foundation, AHF, Kenya Prevention Program. Lillian, many thanks for making time for us here on KTN News this morning.
Yeah.
Health CS Cecily Kariuki says that over 40% of all new HIV infections occur among adolescents aged between 15 to 28.
Yes.
That must be a worrying statistics for someone who deals with prevention programs such as you, I guess.
Yeah. Thank you so much for having me here today. I'm so delightful. And unfortunately, that is so true. We have spiking, like we are rising. The HIV new infections among young people, that is 15 to 24 years. Every day we have 66 new infections among the young people.
66?
66 new infections. And this is the group of people that we are looking to in the future. To be precise, as AHF, it's worrying, and working in the prevention program, it doesn't show a good picture.
And why the increase in this specific age bracket, 15 to 24?
Okay, we could say it's a lot. There are a lot of things that lead to that rate. We can look at it at stigma and discrimination. We can look at it at their exposures. There are a lot of exposures right now. People know a lot of things, and these adolescents have access to the internet. They can access anything they feel and anything they want. So they are practicing what they see. And at this age, we also have a lot of things going on.
When you say they are practicing what they say, are you alluding to pornographic news that they watch online?
Yeah.
And does that contribute to the numbers increasing?
Yes, I could say that is one of the reasons. And I could also say that as an adolescent, you also was at that stage at some point. You're trying to discover who you are. You want to explore. You want to know, what am I supposed to do? Who am I, in short? So when you see these things in the internet, just as you said, pornography, and lots of things, you feel like you need to explore and to feel like the others and to feel you're on board and to fit in your peers. So what we need to do, what we do as AHF, we give the correct messages, safe practices. As they practice what they see, they need to practice safely, because at some point you cannot really
It's good that you're talking of safety when it comes to that.
Yes.
93.7% of HIV new infections are transmitted sexually. It seems as though the abstaining policy is failing, is it?
Unfortunately, yes. And as you just said, the few weeks back, we had a lot of pregnancy cases amongst these KCP students. These are young people, they're adolescents, so they are practicing unsafe sex. That is just clear. So abstinence, yeah, we preach abstinence, but it's not really working. So how can we prevent these young people from getting pregnant, from getting HIV? Let them practice safe sex. That is now what we can just...
And what does safe sex entail?
Safe sex entails, that is after you've talked obviously about abstinence, because they're in school. But if at all they have to practice sex, they need to use protection. That is, they need to use condoms. And mostly at our facilities, and even when we have outreaches, we give free condoms, we distribute free condoms to anyone willing. We don't force. And we tell them, we know that you're doing this, we know that you're practicing sex. Just practice it safely to prevent pregnancies, to prevent HIV infections, to prevent STDs. Yeah, that is a wholesome. And it helps when they use condoms.
Well, when you tell 17-year-olds to use condoms, don't you think you will face some backlash from religious groups, be it Muslims, Christians, Hindus?
Yes, definitely. We really face that backlash, especially in schools. As we go to schools and give these messages, we normally go to certain schools and share health messages with these young people. We tell them to abstain. We can't carry condoms to schools to give kids because it might bring a lot of backlash. But at our facilities, at our hospitals, during the outreaches, these people come to our tents. These young people come and tell us what they do. As a nurse counselor, sometimes I interact with the young people. They tell me, this is what is happening, this is so and so. We fear going to the hospitals because you are victimized, such and such things. But as they come, they are practicing unsafe sex. What can you do as a nurse counselor, as a medic? And
when these students come to you, what are some of the things they tell you?
Okay, these young kids have a lot going on, and the main complaint has been that there's that detachment from the parents, especially the adolescent, 15 to 24 years, even 13 years old. They say that they don't have that good guidance. They can't talk to their parents at home. They can't tell them what they feel. And yet they are doing a lot of things. They have these parties. They go, they meet, they interact, they have unsafe sex, they abuse drugs. So when they come to our facilities, because you don't know them, and you explore, you contract well with them, they tell you a lot of information, what is going on. They had parties like over the weekends. They have these group parties and they have this group sex. Unfortunately, that is what is happening among
for a school-going children who is 3 months away from his parents, the role of often the teacher and those whom they spend those 3 months also comes into question. Do you think, in your individual assessment, that teachers and schools as well are failing to educate youngsters on HIV/AIDS?
Yes, I feel at some point the curriculum being used right now in schools, I don't think it is that effective. I think the teachers need to be trained on how to teach this sexual reproductive health. They teach from class 6, and they need to tell these children what is real, what is there. At some point, I feel that they come conservative at some point. They can't talk some things in class because they fear, they are not trained, they don't know how to put the message across. But we need to tell these people what is real, what is happening, because they get the wrong information outside school.
Fair enough.
And yes, and yet most of the time they spend with the teachers. So if the teacher cannot guide, and yet they come at home, again the parent is not there, working somewhere else, there's a big gap.
And sex is not the only way through which HIV is transmitted. What are some of the other ways in which the virus is transmitted from one individual to another?
Okay, there are several ways that you can get HIV. Blood contact, even in accidents, as it can occur. Maybe you're seated next to a person who is positive, then you have this clash, then your blood contact. But that is a very low percentage. It rarely occurs. Then there's this mother to child, of which now we are doing eradication of mother to child. We used to have prevention of mother to child, which you give the mother who is pregnant and is HIV positive, you give drugs to prevent them from transmitting the infection to these fetus or during delivery. Now we are eradicating because there are very minimal cases of mother-to-child transmission. At least that's the wow factor for us. And there's also this needle prick. And it's an exposure for these healthcare workers. As they draw blood from this client who is HIV positive, then they prick themselves. They can get infected. But we have prevention measures, which is we use post-exposure prophylaxis. There's a treatment they take for 28 days to prevent them from getting infected, of which that is also a very minimal way of transmission for HIV. It's a get 0.1%.
Fair enough. You said there are 60 new infections daily. 3 out of these 5 infections, 3 out of every 5 infections are of women. Why is the number specifically high when it comes to women?
Okay, that is a tricky question, because we could say that these infections, okay, first of all, the way women are made, the biological anatomy of a woman places you at risk of contracting STIs and any infection. As you have sex, you're at a higher risk of contracting. So
can one as well argue men are of a different biological makeup that also places them at a risk?
Men are, I couldn't say they are safer because they have poor health-seeking behavior. They don't go to hospitals.
We'll come to that on men. I want to finish on women.
So when we talk of women because of their biological anatomy. The way they sleep with men, they are receptive. So it places them at a higher risk of contracting HIV. And again, most of them are tested regularly. So that's why we come up with a higher percentage of women who contract HIV.
When you say most of them are tested regularly,
yes.
Am I allowed to finish the sentence that men are not tested regularly?
Men are not tested regularly. And if you could allow me, I could explore more on our theme for this year, World AIDS Day celebration, which will be on 1st of December.
We'll come to that, but why
Yes.
men? Why men? Why is
Men don't go to hospitals. They have poor health-seeking behaviors. To be practical, even as I talk to you, before you decide I'm going to hospital, it's at the last minute when you're really, really down. At some point, you go to the chemist, you just get painkillers. At some point, you wait for your wife to get tested. Then when she comes home, you're like, oh, how was the results? Was it negative? Then we are negative. So we could say that they don't go to hospitals. We might have discordant couples. We might have the wife is negative, the husband is positive. And when he dwells so much on the wife, waiting for her to go tested and then come back home, he's living positively, and yet he doesn't know.
And as someone who counsels youngsters, and someone I believe who has as well dealt with men, what often stops them from seeking tests?
Okay. As we've had several focus group discussions, men tend to say they are busy. They don't have time to go to hospitals, and again, they are very busy getting to provide for their families, and yet, in real sense, it's just that they don't like wasting time. They don't have time for that. They feel like, I go to the hospital, I waste time, I queue here. But for the women, it's a must, because when you get pregnant, because when you want family planning services, you need to go to that hospital, you'll get tested, you need to queue for you to get the services. So at some point, we find that men, they just feel like it's not a must for them to go to hospitals.
And when you say it's not a must, they think it's not a must. Are you talking exclusively of HIV case, or generally their health?
Generally, health-wise for men, I think they have poor health-seeking behaviors, not just for HIV, but when they come to hospitals, that's when we get to test them for HIV, even if they're having an STI or maybe a headache or maybe something else. But for them to come to that hospital with that disease, it takes a while. Maybe they come when they are very down, maybe for admission, such cases.
And for instance, a man who is watching this show this morning and maybe asking himself, why do I need to be tested? What will your answer be?
I would recommend men to get tested, because living positively and yet you do not know your status, it makes it worse for you. You find that you go to the hospital, maybe for these private facilities, you don't want to get tested, you spend a lot of money, every now and then you're in and out of hospital, you're feeling unwell, and yet the infection is HIV, which you could get information and the right medication and stop these trips to the hospital now and then, because you don't have that time. And again, living positively and taking drugs improves your way of life, because you might live positively, yet you don't know, you infect other people, so the infection rate goes high. So in general, seeking HIV test is so important for these men to know how they live, to plan their future, to live a healthier life, to avoid transmitting the virus.
And how easy or difficult is it in seeking a HIV test?
Right now we have different interventions. We are growing health-wise. We have the self-test kit. And I could say that the uptake for men has been very good. They prefer taking the kit and going and testing at home, because it's so easy to use, and it gives instant results. So we have different interventions, like a self-test that you can just take at the facility and you go to get tested at home. When the results are positive, you need to go back to that facility and get the full test. It's just like a pregnancy test strip.
Which can be done from
anywhere.
Your
yes,
house.
and even at the pharmacy you can buy, you can afford to go and buy without really, sometimes it's stigma. The issue of stigma also affects men. They don't want to be seen going to that VCT. So you can go to the pharmacy, maybe buy that kit, go at home. You can buy one for you and for your wife or for your family, then you get tested, then now you go to the facility. 30
years, if not more than 30 years, since the first HIV case was reported in Kenya. Why does it still seem as though HIV is equated to death?
Okay. I could say that the new infection in 1984, that was when the first person was identified was HIV positive. People had that bad picture. HIV was related to that skinny guy who was so thin, who could die anytime. And there was a lot of stigma around it, maybe because due to the way it's transmitted. You've seen that the percentage of sexual infection is very high.
93.7% of new infections.
So that one is still in people's mind. They think that you're HIV positive, maybe your ways of living were not that right, and it was through sexual. So using that mentality, a lot of people still have that fear towards HIV. A lot of people have that stigma and discrimination towards HIV. A lot of people think that they don't have that information to know that there is treatment now. We don't need to discriminate these people who are positive. We don't need to stigmatize them. And it's working. I could say that it's working. From the year 2000 moving forward, we've had a lot of growth.
I understand now we are joined by also the National Prevention Ambassador in studio. Many thanks indeed for making time for us, and sorry for the delay. Picking up from where she left, are we preventing more than we are actually scientifically knowing?
First, I would love to say that we don't have AIDS. We are combating AIDS. We don't have AIDS in Kenya because we have ART. ART are ARVs. So AIDS was there in 2001. That's the last time we have AIDS. AIDS is a collection of diseases that come together. So right now, people are suffering from HIV infections, not AIDS. So AIDS is the last stage for somebody to die. So
and does it, with the advancement in medical treatment, does it get to that last stage as of today?
No. If you're using your treatment well, right now we are not doing CD4. We are doing something called viral load suppression. We want to look at if you're using your drugs, medication well, it's a source of prevention. So from there, we put you on treatment and make sure that you take your drugs well. That's why when you are tested today HIV positive, we have something in a scope guideline called test and treat. We put you direct to the treatment so that you start taking your drugs well so that we can clear your viral load. From there, you're going to live alone.
You clear the viral load? You mean getting
the viral
zero
load?
or
The viral load,
the
percentage, when you have 20%, you have achieved your viral load. So from there, you will not have these communication diseases like malaria, homa, TB, because you are on treatment. So viral load, the drugs make your immune system to be very strong. So the HIV virus does not survive in your body. And that's why we are very sure as a country that we are achieving it. And the drugs are working.
Drugs are working?
Drugs are working.
This is according to?
According to National AIDS Control and NAC.
Fair enough. And let me get Lillian to the conversation. Why has it over the years become as well difficult to get a cure for HIV?
Wow.
Okay.
That's a little bit scientific.
Yeah, it's a little bit scientific. And
yeah, okay. A cure to HIV,
I could just point out one thing. We have these, during viral load replication, the virus tends to twist. When you get this infection, when you take this drug, you think that, like, for instance, for malaria, the parasite, we know that when you give antimalarials, it clears the parasite from your system. But with this virus, it tends to replicate. When these drugs get into your system, they've switched the way they behave, and it gets hard for them to be cleared off your system. As Baridi has just said, when you come to low viral load detections, you're safe, and your transmission rates are low, but you cannot say that you're HIV negative. The virus is still in your body.
Can it be detected even though it's low?
Yes, it can be detected using the PCR, which is it tests the DNA of the virus. But sometimes when you test using the determine, you can test negative. So those are the miscommunications maybe some people get when they go to the VCT. They're like, I'm negative, I was prayed for, I've been taking these drugs for 10 years. Then they stop taking these drugs. Then at some point, it erupts. And
it's good that you preempted a point I was coming to. But before that, let me give Baridi a chance to as well respond to that. Why has a possible cure to HIV over the years become
I think you read it in the magazine, newspaper, where we have 99% of drug that is coming to the country. HIV cure is still on the process, and As a country, we're also hoping that we're going to get that drug to cure the people who are HIV positive. According to the statistic, we have 1.6 million people who are on treatment, ART. We have 400,000 people who are tested positive and disappear. And the number...
They disappear, they don't seek medical treatment.
They didn't went for testing. They didn't went to take any care and treatment in a facility. Now, these are the people that we want to get and test, especially men. I understand you guys were discussing men and everything, because we have a problem with men and testing, so we want these people to come and do the HIV test so that all of them, we can put them together and look at how can we treat and give them.
And what often is the problem? I understand Lillian answered that question, but I want to get it from a man's perspective now. What is often the problem of men and testing?
Women test a lot because when, for example, if a wife or a woman, she's pregnant, when she goes to the hospital, she will get tested. Anytime that women goes to the hospital most of the time, men does not go to the hospital. Like they say, I'm strong, CND. Me, I'm a man. I don't know when last time I went to the hospital.
To test for anything?
To test for anything. Mm-hmm. Men will only go to the hospital when maybe they're in wheelchair, or they got accident from motorbike, or they are sick terribly. But women, if he has a fever, she will go to the hospital and ask doctor, what do you think I can do? But men does not have that urge. And the other thing that we are doing, we call it partner testing. For example, if Lillian here, she's my wife, and Lillian has gone to the hospital and tested negative, she'll come and tell me, I went to the hospital, I was tested HIV, and I come negative. Me as a man and the husband, I'll say, okay, I'm also negative. Are you getting it? Mm-hmm. So men...
Negative without even testing.
Without testing. Men does not test.
We have exhausted on that point. What is often, Lillian, the importance of testing, being diagnosed at an early stage?
Testing and being diagnosed at an early stage helps with during the disease progress. It might be so hard for you to return that person to the normal state at a later stage of HIV. You won't get to that stage of AIDS, as Marija just said, because you'll take the medication well, and we have opportunistic infections which really affect these people when their immune system is eaten up, because HIV really affects the immune system. And when you start the medication early enough, we protect the immune system. The immune system is when you're in a house, like the building that protects you. And when the building is protected, we can't get these opportunistic infections, which really weigh down. These are the things that lead you to AIDS stage. And when you start ARTs at an early stage, you could say that it helps you to curb down opportunistic infections, and it slows down the infection transmission rate. You cannot transmit the infection to your partner or any person that you're...
Fair enough. But ready to get you to the conversation, you are the National Prevention Ambassador.
Yeah.
When you talk to young people about HIV, what is often the first response they give you?
HIV has a stigma, and the big stigma that we have in HIV world is the stigma that came in 1980-something when President Moi called HIV as a national disaster. So no one has rectified it. For example, if a young person tell a young girl that I want to date you and I'm HIV positive, you know, oh, I don't want to die. Are you getting it? So HIV, we are still having a long way to go because of the stigma. Young people does not take HIV serious. They look at HIV as a death sentence, and that is what not only even the government, not only even NHF or any organization, it's a work that each and every...
To be fair, it's not only young people who view HIV as a...
No. Old people, let me tell you something. HIV in old people is fine. Some of them understand, but most of them does not understand. But young people, I want to tell you something which is happening right now, that most of the people in this country who are positive are young people. And they were born with HIV virus.
Most of them were born?
Most of them were born. In fact, 98% of these people that you see were born with HIV virus. So when they were born with HIV virus, some of them are still virgin. Now, the stigma is coming when now the young generation does not understand what is this virus. But older generation, that's why we have NEFAC. NEFAC is a national network for people living with HIV. It's for everybody. But most of them are old people who already fought. They already go to the road. They're the one who make people to have drugs and ARVs. But there is no network for young people talking about HIV status. So the young people still have that gap.
And what is holding young people from having such networks? They can if they want to.
They can if they want to. We have tried. But what holds the young people to have such network? Because they don't have somebody to carry their hands and walk with them through this way. They have a lot of depression. They have a lot of stress. Young people, what is happening, not even in Kenya, I was in Rwanda, what is happening in the country is that not even in Kenya, in the whole world right now, young people are neglected on these issues of HIV, like, ni mtoto, let's leave them alone. So they need a country, they need a government that can come together and say that now we are here to support you. For example, you see early pregnancy Narok is leading, right?
Yes.
If you see social media, everybody is accusing these young girls, you are getting pregnant for what and everything. They are being accused more than being corrected and talked to.
Fair enough. As we conclude, Lillian, what is the correlation between HIV and counseling? How important, rather, is as well counseling to HIV?
Okay. HIV and counseling is very much related because these infection people still relate it with the stigma and the way it's transmitted, and a lot of people still think it's a death sentence. People need to get the right information and the right counseling skills in order for them, even if you're tested and you're positive, you need to know that now my next step is to visit a facility, get treatment, and live like the other people. And you need to also get assistance for people who are already infected and tell you how they live. And you need to know that it's not a death sentence, really, and you just live a normal life. Like
fair enough. Baridi, 30 seconds. What is the correlation between HIV and counseling, and how important are the two together? Tradition
is the worst enemy of civilization in Africa country. We need to get young counselors who understand what is HIV. And from there, we can make this country a better place to be. Thank you.
Baridi, National Prevention Ambassador, and Lillian Ndukwe, AIDS Healthcare Foundation, AHF. Many thanks for making time for us.